Hello, staff of ABC Medical Center. Thank you for taking the time out of your day to watch this information session on our new EHR system that we will be integrating into our hospitals and our clinics. I'd like to take a moment to introduce myself. My name is Lauren Goujon. I am the CEO of ABC Medical Center. I have been with the company for a very, very long time, so I am thrilled to introduce this new EHR system into our company. It has been a process working on this, getting started with our hospitals and our clinics. It is definitely not going to be an easy start, but we will work together as a team to get this going. So thank you for your support and for taking the time to work for ABC Medical Center. We thank all of our staff. So I would like to talk about some advantages of the new EHR system. One of the biggest things will be the communication within our hospitals, and then our communication from our hospitals to our doctor offices, to the outside pharmacy centers, and to the outside specialists that we do work with. We will all be able to communicate with them through this new EHR system. It will help us be able to provide the best care for our patients. Our motto is that our patient matters, and that's what we want to continue providing the best care for them. So as we talk about this EHR system, we will talk about how the EHR system can work in the hospital, a little bit about how we will be able to integrate patient to physician clinic communication, and a little bit about our social media that we will be starting as well. So we will start with the part that is in the hospital. From the moment that a patient is seen in our ED, we will be able to start a chart on that patient. In the future, we'll be able to see if the patient has been with us before. Is this a first-time encounter or a return encounter? Or were they in here last week for seeing us for the same thing? It will allow us to better manage the care of the patients that we do see. So from the moment that they're seen in the admission department, and they're seen and trying to triage that patient, the nurses will be able to immediately input vitals, and from there the physicians can say, hey, I've got a new patient, let me go see them. They'll be able to stand there, talk with the patient, assess the patient, order imaging, order labs, order anything from the pharmacy just by clicking on a few buttons. From there, the nurses will know, what do they need to get started? Do they need to start an IB? And where to go from there to better care for that patient. So that will be nice to be able to have everybody working together as a team to care for the patient. It will allow us to give more time to the patient. We won't be running around as much as possible when we were using paper charts. Paper charts are really becoming obsolete and a thing of the past. Technology is the way of the future for healthcare, and we want to make sure that ABC Medical Center is on top of being a part of that and staying up with the new technology available. So once someone is seen in the hospital and they're going through the coursework from the admission to the medical records to the billing and coding departments, they're going to be able to see everything that that patient was in our hospital for and code and bill that encounter properly, which will allow us to have a higher revenue. We will also be integrating an app and updating the website, which leads into our social media part as well. So on our website, our patients will be able to make appointments. They will be able to review recent doctor visits, recent hospitalizations. They'll be able to see labs that were drawn, images that were done, and the doctor's notes on that. There will be a confidentiality that they do have to sign. So that way they understand that the website is just for our patients' use. They are allowed to share that information with anyone if they do go to a new doctor or somewhere else in the state to receive care. This will also be a part of our app. We will be having the app that will come up, and it will do almost the same things that our website will do. They will be able to communicate with the doctors using text message on the app. On the website, they'll be able to use a chat box that comes up and ask them if there's anything we can assist them with. So through the app and the website, they'll be able to message the clinic, say, I need an appointment, I have this going on. We will also be having a telehealth part of the website and the app. that will allow them to communicate with the physicians in the clinics. So if they, they've got a weird rash, is this something, that's just an allergic reaction to a new detergent, or is it something that needs an antibiotic? They'll be able to send pictures into the physicians and say, hey, this is what I have going on. And the physicians will be able to go ahead and say, yeah, that looks like it's just, a normal rash, or yeah, that's poison ivy. Let's go ahead and treat it with an antibiotic. So they'll be able to go ahead and do it that way. They'll be able to send a note into the pharmacy and give them the heads up, say, hey, I'm sending the script into this pharmacy. Go ahead and pick it up when it's ready. So again, allowing better communication with our patients and our physicians will also allow us to have more time in the clinic for patients that may need to be seen by the doctor more. It will also help us better follow our patients outside of the hospital as well, because they'll be able to say, hey, I'm a newly diagnosed diabetic. I have some questions. I have some concerns. Sometimes it's just a simple, hey, this is what I have going on. Do I do this much insulin or this much insulin? And sometimes they just need a little reassurance. We will be able to provide that through our app and through our website. The app will have a 24-hour nurse physician hotline. That way we can better serve our patients all day long. Into the hospital again, we will be able to really communicate better as a team going through the different stages of the hospital course. There will be, the administration department, that provides, the financial and the patient administration part. There'll be dentist and optometry part that allows us to better communicate with outside dentists in the optometry to say, hey, this person was seen in the hospital. We handled this part, but this part you guys need to handle. The health information data will reflect in real time, again, onto the website and the app. So even when the patient is in the hospital, they will be able to see what is going on with them. Order entry management, so all kinds of orders on a secure network. We can submit orders within the hospital. We can send orders out to the pharmacy. So when a patient is discharged, they've already got the orders sent out and they just have to take their hard scripts with them. It is easy for the physician to go ahead and order those. It prints out and they do have to just sign it right then and there. It will make things a lot simpler. They're not going to be having to carry around a notepad with them that has, their prescription pad with them all the time. We'll be able to provide better patient education and health monitoring along with the telehealth. On our social media front, we will be having a Facebook, a Twitter, an Instagram account, as well as an email newsletter that we will send out for our patients that are not as tech savvy. This will all include little updates as far as this is what we have going on in the clinic, this is a flu shot clinic that we're doing, or this is an information session that we're doing on diabetes management, cardiac care, and just going from the future in that sense. So we will be able to better manage it, better be able to stay up to date with our younger patients who are more tech savvy, and being able to provide them with the best care. Some benefits also will be the costs. It'll give us a greater financial return seeing that patients will be able to have the app on their phone. We can send up alerts that will allow them to say, oh, I have a payment, and be able to just go ahead and pay that right there. Set up a payment plan within the app. Sometimes that makes it easier for patients to pay their bills. So that will be able to be available to them as well. It will lower the cost of the patient care as far as, we're not going to be using as much paper. They're actually going to be able to sit in front of the doctor and say, this is what's going on and this is what I need. So we're not having to overbill or underbill for our patients as well. So that's going to be quite nice. It'll be a lot less paperwork going through our physicians' offices as well as the hospital itself, so that, there's going to be a lot more communication available to our patients, and that is what we want to see in the future, is more patient time with our patients and less time writing down in papers and having physicians write so fast because they're so busy, and that our billing, is not properly billing because they're not properly doing it in an appropriate time. So I thank you all for coming, and I appreciate the time that you took to listen to this information session about our new EHR system. We will continue to provide training and information sessions as we go about this new integration. So thank you so much for working for ABC Medical. Have a great day.